Well, the Affordable Care Act is a tremendous change for the way we're doing business. We used to get paid for, fee for service, and now we're going to get paid for fee for value and for taking care of people over a long period of time. So it's changed everything. The anxiety level in the healthcare delivery system is enormous. We really don't know how it's going to work over what period of time. As far as the Supreme Court is concerned, what we'll see is mandates get struck down, then it's going to change how we pay for health care. And the question really is about mandates. What's going to happen to corporations? Are they going to continue to have private insurance for their employees, or are they going to pay the penalties and save a lot of money in the process and throw all those employees now into the Medicaid arena for their insurance or into the exchanges? So we don't know what's going to happen there. We lose money on Medicaid patients right now and Medicare patients. And across the country, Medicare pays about 5 to 6% under the cost of delivering the care, and Medicaid pays about 13% under the cost of delivering care. So hospitals across the country lose money on those, and it's made up for by the private insurers. The law does a great job in terms of increasing the number of people being covered. 40 million people have now got coverage. Second thing the law has tried to do is increase the quality of care, and they have increased the number of things that we're being monitored on. We know now we're having 65 things that we report to the federal government. We know it's going to 85, and it will continue going up, and so it's improving the quality, but not by leaps and bounds, slowly getting better.
Now, is that a pain or is that a good thing?
That's a good thing. Okay. That's a good thing for patients. It's the right thing to do for patients, and we're thrilled to do that. The third thing is we're trying to decrease costs, and there's very little in the bill that is going to decrease cost across the system. And we've got to have things in the system that really drive the cost for the whole bill for the country down.
What wasn't in the bill that needed to be in the bill? What do you think? What hasn't been fixed?
Well, one of the things that hasn't been fixed is we haven't put the incentives in to drive personal responsibility for your health. There's very little of that. And so you can be a smoker and then expect people to take care of your cancer of the lung or your respiratory diseases. There's little in it that drives people to take care of their weight problems. Hopefully, with some of the legislation that's being proposed now, we're going to see some of that stuff coming into the bill, which I think will be a tremendous asset. There are a lot of pressures from a financial standpoint that will drive consolidation of hospitals over time. And I think that's a very good thing. And we have been a tremendous advocate for having not all hospitals be all things to all people, but having bring services together in hospitals that bring quantity of patients, and with quantity of patients comes quality and efficiency. You do something over and over again, you get better at it. We started looking at electronic medical records 10 years ago, and we have invested very heavily in IT across all of our ways to look after patients, including pumps, including respirators, all that sort of stuff that were directly tied to electronic medical record. We probably over the last decade have spent $1 billion just in bringing IT into healthcare. And you realize that you can't take healthcare from an art to a science without having numbers. And you can't keep track of numbers without having computers. And so that's what we've really done. And it's been a huge, huge learning curve. And that doesn't even count what it takes to maintain those as far as the people. That's probably another $150 million a year just for the personnel to maintain it.
So do you see other hospitals around here struggling with that?
A lot of hospitals around the country are struggling. We're probably only going to see at the end of this year 30% of the hospitals in the country having meaningful use in terms as how it's defined federally. I suspect in 2-3 years it may get to 50 to 70%. I think a lot of hospitals are going to struggle with this, not just because it's expensive, but it also takes a tremendous amount of learning and education for physicians, for nurses, for everybody involved in it. It's a massive infrastructure, but it's going to drive quality at the end of the day.
Are you more worried about when the law gets implemented or it being struck down?
Well, right now what we're worried about is having some framework in which we can plan. For example, I know that I need new buildings but am I going to be able to afford to have those new buildings? We don't know exactly what the final form of the law is going to be, nor what it's going to pay us, or how many patients are going to be coming to us. And so it's very difficult to plan for the future. And we've got a $6 billion organization with 40,000 employees, and we're trying to figure out how we plan for the future. It's just not clear. And that's the level, that's where the anxiety comes from in the healthcare. Tell us the rules and we'll know how to play the game. Everybody in the country is involved with healthcare. It's about every one of us. And so nothing could be more pervasive. And I think the more we have the dialogue, the better. But the rhetoric has to tone down. It is not a political issue. It's a personal issue for absolutely everybody in this country.